Hello everyone, welcome to my another video. Today we discuss about most important MCQ for upcoming Norcet exam. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 12. What is the first sign of immunosuppressed patient? Option A, headache. B, nausea and vomiting. C, fever. D, dizziness. Right answer is option C, fever. Patient can be immunocompromised or immunosuppressed either because of a medical condition or because they receive immunosuppressive medications or treatments. Fever is the first sign of immunosuppressed patient. Next question. Which of the following is the best treatment of nocturnal enuresis? Option A, punishment. B, imipramine. C, desmopressin. D, positive reinforcement. Right answer is option D, positive reinforcement. Nocturnal enuresis is defined as the repeated voiding of urine into clots or bed at least twice a week for at least 3 consecutive months in a child who is at least 5 years of age. Among the all treatment options of nocturnal enuresis, positive reinforcement is the best treatment. Next question. The common veins used for placement of central line are all except option A, subclavian vein. B, internal jugular vein. C, femoral vein. D, tibial vein. Right answer is option D, tibial vein. Subclavian vein, internal jugular vein and femoral vein are used for placement of central line, but tibial vein is not used for placement of central line. Next question. ICDS program was launched in the year option A, 1980. B, 1975. C, 1992. D, 1990. Right answer is option B, 1975. ICDS program or Integrated Child Development Scheme was launched on 2nd October 1975. ICDS scheme represents one of the world's largest and most unique programs for early childhood development. ICDS is the foremost symbol of India's commitment to their children and India's response to the challenge of providing preschool education on one hand and breaking the vicious cycle of malnutrition, morbidity, reduced learning capacity and mortality on the other hand. Next question. Cystic fibrosis is associated with option A, congenital pyloric stenosis. B, peptic ulcer. C, meconium ileus. D, all of the above. Right answer is option C, meconium ileus. Cystic fibrosis is an autosomal recessive inheritance and the symptoms of cystic fibrosis are salty tasting skin, upper and lower respiratory tract infections, lung infections, poor growth or weight loss and meconium ileus. Next question. Which of the following is a surgical procedure used to correct a deviated nasal septum? Option A, septoplasty. B, valvuloplasty. C, annuloplasty. D, none of the above. Right answer is option A, septoplasty. Septoplasty is a surgical procedure used to correct a deviated nasal septum. This procedure allows better airflow through your nose and it improves breathing. Septoplasty is usually an outpatient procedure, so patient can go home in the day of surgery, and swelling may last for 2 to 3 days, but the full recovery requires 3 months. Next question. CAGE questionnaire is used for option A, heroin screening. B, alcohol screening. C, opioid screening. D, naloxone screening. Right answer is option B, alcohol screening. CAGE questionnaire is a set of questions that used for alcohol screening. The letters CAGE stand for C for cut, A for annoyed, G for guilty, and E for I. The CAGE questionnaire is a relatively accurate, quick way to screen people for alcohol dependence without making someone defensive or upset. Next question. The common side effect of CPAP masks is option A, claustrophobia. B, hydrophobia. C, acrophobia. D, none of the above. Right answer is option A, claustrophobia. CPAP mask is continuous positive airway pressure mask. The common side effect of CPAP mask is claustrophobia. Next question. High potassium diet should be avoided in patients with option A, CKD. B, diabetes mellitus. C, renal failure. D, both A and C. Right answer is both A and C. High potassium diet should be avoided in patients with CKD and renal failure due to risks of hyperkalemia. Next question. Which of the following vitamin deficiency causes xerophthalmia? Option A, vitamin K. B, vitamin E. C, vitamin A. D, vitamin B. Right answer is option C, vitamin A. Xerophthalmia is a spectrum of ocular disease occurred by the deficiency of vitamin A. The clinical features of xerophthalmia are night blindness, conjunctival xerosis, Biot's spots, corneal xerosis, corneal scare, xerophthalmic fundus, corneal ulceration or keratomalacia, etc. Next question. A child come to OPD with fever for 24 hours. History reveals 3 episodes of chest infection and passage of foul-smelling stool. What is the most probable diagnosis? Option A, maple syrup urine disease. B, cystic fibrosis. C, Crigler-Najjar syndrome. D, none of the above. Right answer is option B, cystic fibrosis. If the child have fever, 3 episodes of chest infection in past, and patches of foul smelling stool, then the most probable diagnosis is cystic fibrosis. So this is the today's video. Thank you so much for watching my video.